Hi, my name is Dr. Antelak. I'm from thegentledentist.com. We're in Shelby Township, Michigan. 586-247-3500 is our phone number. And what I want to do is to talk to you a little bit about sleep apnea. Sleep apnea, or the stoppage of breathing when you're sleeping, is something that is a real health problem. It in fact can cause daytime sleepiness, drowsiness. People are driving their car. It can help. It actually responsible for them having to fall asleep at the wheel and causing auto accidents. It also has, with sleep apnea, caused a lot of problems with sleep disorders. So you never get enough adequate sleep. You never get down to the deep levels of sleep that's required to refresh and re-nourish your body for overall health. People who have sleep apnea, who actually stop breathing more than 10 times an hour, it's a problem. It can actually lead to heart disease, high blood pressure. It can lead to diabetes. The reason why that is that when you stop breathing, your body kicks adrenaline into the bloodstreams to keep it from, you've got to keep breathing. That's the body's most important function, is to keep breathing, to keep the brain oxygenated. So what will happen is, rather than being able to sleep, your body will wake up. You'll be snoring along, and all of a sudden you'll like this, stop breathing, and then gasp for air. It's during those gasping times, when you try to reach for that breath, is when that body is surging. So it really is responsible for a lot of health issues related with high blood pressure. And the reason why sleep apnea, what develops, is that it's in the back of the throat. If you don't have enough space to breathe, for your soft tissues, for the hole that goes down into your trachea, that goes down into your lungs, if that space gets too narrowed, snoring starts with the back of the throat actually vibrating as air passes back and through it. But as people start sleeping, they get more relaxed, they get more drowsy, and they get to a deeper level of sleep. They have less body control, and then the airway completely closes off, and then you get these episodes that take place. The best way of treating this, well, number one is you have to be diagnosed by your physician, and then have, usually it's called a sleep study, where you spend the night at a sleep lab. It looks like a hotel room, and you're connected up with a number of different leads and attachments, so they can monitor all the different vital statistics in your body. Well, after that takes place, then they get a monitor exactly what your numbers are, and they'll usually recommend what's called a CPAP. A CPAP machine is a device that goes over your whole face. Looks like Darth Vader face, and it pushes air into your lungs, and it forces air into it. Well, the problem with that is the best thing to use, but the problem is compliance. A lot of people are not real compliant with it, so they stop using it. So in dentistry, we have an ability to do what's called a sleep apnea appliance, and that's this. What this unit does is it prevents the lower jaw, when you're sleeping, from going back too far. There's little leads like this. On this case, or on this unit here, it's got some plastic pieces that are mobile and a little bit loose like that. But either case, it prevents the lower jaw from seating back into that airspace and from closing the airspace off. So if you found yourself with using a CPAP machine, you're unhappy with it, you just can't get used to it, it's something that you just decided, you said, I'm sick and tired of this, there's an option. And that option now is to use called an oral sleep appliance, an OSA, and what that OSA does is it really helps to open up that airway so you can sleep, so you can breathe well, so you get a restful sleep at night, so that you're completely fully aware and function for the next day. And it's also to help with your heart rate, your blood pressure, even your weight. It keeps everything down. So if there's questions about that, our website is thegentledentist.com. Our phone number is 586-247-3500. Thank you, and happy sleeping.